Hi, my name is Malik Sampson, and I'm a social marriage and family therapist at HateU.org. And today I'm here in partnership with Brother Bewell to talk to you about mental health disorders. And the mental health disorder today that we'll be discussing is agoraphobia. And before we get started talking about this mental health disorder, just wanted to put the disclaimer out there that again, these videos are not intended to give you a full scope of the disorder, nor is it intended to treat or diagnose any disorders, but to give you kind of a brief overview and key components of these disorders and what things to look for and what you can see within these symptoms. And in addition to that, if you are experiencing you or anyone you know are experiencing any type of hardships where it's causing you to feel the needs for self-harm or suicidality, please feel free to reach out to your local emergency contact, 911, and then in addition to that, you can text the crisis hotline, help at 741-741. So, I want to get started now to tell you a little bit about agoraphobia. And first thing is that this is an anxiety disorder. So a big component of this is anxiety, and that's where it stems from. So this develops after you have had a panic attack and you're starting to have that feeling of avoidance, of fear, of places that can trigger that type of reaction and response in you again, in places and situations that can cause that panic to happen. And that panic a lot of times can look like helplessness. It can look like you feel like entrapped in something or some type of embarrassment situation. All those are just three different types of ways that this panic can come about. And within that panic, there's a lot of different symptoms that come into play as well to be aware of. And some of those symptoms include like rapid heart rate and upset stomach. You can have like physical components as far as like the upset stomach and the chest pains, being kind of like lightheaded and these type of experiences and shaky. And like when you have this like shaky experience and these are these physical components that you start to see within this mental health disorder. And it's really important to know that these mental health connects to these physical components that you're starting to feel within your body. And that's one of the main things that a lot of people forget too, that mental health plays such a big role into how you feel physically. And so it's important that we know this information about agoraphobia, because I do think this is one, sometimes it can be overlooked. And so just knowing that it is a type of anxiety disorder. So within that, the treatments that can be done with this type of anxiety disorder is, therapy and self-care and different types of medications. But using the components of going to therapy first and then consulting with the medical doctor and then trying these things and figuring out what can work for you is very important if you feel that you're experiencing any of these things. So as always, if you have any questions or concerns and you want to know any more information, please feel free to reach out to any medical or mental health professional to give you more insight. And again, my name is Malik Sampson, and reminding you, brother, be well.